Hello, everyone. Thank you all for joining part 1 of the Healthcare Associated Infection module for laboratory identified events of Clostridioides difficile infection, also known as CDI. My name is Ty McCrae, and I am an infection preventionist contractor with the CDC. As your presenter, I will provide an overview of CDI. The learning objectives for this presentation are: we will demonstrate an understanding of what laboratory ID event surveillance and reporting requirements are for NHSN. We will explain the CDI definitions and protocols. We will define the required monthly summary data for CDI reporting. And we will describe how to manually enter CDI LabID event data and monthly summary data into the application. Surveillance must occur for all residents' care locations in the facility and cannot be limited to individual units, pods within the facility. Facilities must submit all positive C. difficile laboratory assays collected from a resident while he or she is physically housed in the reporting, including those that may be considered duplicate CDI events with positive lab assays, in addition to specimens collected during a brief outpatient visit. I would like to note NHSN will remove the duplicate specimens from the calculated rates. The engagement for NHSN surveillance and reporting for LabID event module is if a resident is admitted, which is considered inpatient stay, to another healthcare facility. Lab tests collected during his or her admission in that facility do not count towards LabID event reporting for the long-term care facility. A NHSN monthly reporting plan for the long-term care facility must be completed for each calendar month in which a facility plans to enter data into NHSN. For each participating month, the facility must report numerators, which in this case would be CDI and/or MDRO LabID events, and a summary denominator data, such as a total number of resident admission resident days. To verify the quality of your submitted data, all alerts must be resolved for the month. We also recommend that facilities report for at least 6 consecutive months to provide meaningful measures. There are several reporting options in the LabID event modules. Users have the option to report C. diff as well as common multi-drug resistant organism LabID events. Within the module, you may elect to follow one or all of the ones identified on the slide, organisms. I will now share a few key terms and definitions for C. diff. The C. diff positive laboratory assay is an unformed loose stool that tests positive for C. difficile toxin A and/or B. It also includes molecular assays, which are known as PCR, and/or toxin assays, or 2, a toxin-producing C. difficile organism detected in an unformed loose stool by a culture or other laboratory means. The CDI laboratory identified event, which is known as CDI LabID, Those laboratory assays are collected while a resident is under the care of the reporting long-term care facility. It includes residents that are physically housed and cared for in the reporting long-term care facility and residents being cared for during a brief outpatient visit in which the resident returns to the reporting facility on the day of the outpatient visit or the following calendar day. CDI LabID events also includes facility-wide inpatient, which is known as FAC-wide in, and those are all resident care locations within that facility. And then you have the LabID event date, which is the specimen collection date. Facilities should not submit specimens that are either negative or collected during an admission in another healthcare facility. Please note, NHSN will categorize the CDI LabID events based on the specimen collection date to determine if each entered event meets the definition for a duplicate, incident, or recurrent event. So to define the duplicate, incident, and recurrent, a duplicate event is any CDI LabID event that is submitted by the reporting long-term care facility for the same resident in the facility following a previous CDI LabID event within the past 2 weeks. An incident is either the first CDI LabID event ever submitted by the reporting long-term care facility for the individual resident in the facility, or a subsequent CDI LabID event submitted more than 56 days, which is considered 8 weeks after the most recent CDI event. And a recurrent CDI LabID event is any CDI LabID event submitted by the reporting facility more than 14 days, which is 2 weeks, or less than 57 days after the most recent CDI LabID event, which is submitted by the reporting long-term care facility. Let's take a deeper look into these categorizations. For a CDI LabID event, NHSN has an algorithm built into the application to determine if the event meets the NHSN criteria for a long-term care facility onset or a community onset event. All events categorized as a community onset will be further categorized as an acute care transfer long-term care onset, which is known as AC-LO. If the resident was recently transferred from an acute care facility. A community onset is defined as a date specimen is collected 3 calendar days or less after a current admission to the facility. The long-term care facility onset is a date specimen collected more than 3 calendar days after a current admission to the facility, which is considered on or after day 4. LO events are further subclassified for acute care transfer long-term care facility onset events with a specimen collection date 4 weeks or more following the date of the last transfer from an acute care facility, which is considered a hospital, a long-term care acute care hospital, or an acute inpatient rehabilitation facility. In this example, data entered into the NHSN application will analyze based on the following: date of current admission to facility, date specimen collected, or if resident was transferred, date of last transfer. As previously mentioned, you have your categories of community onset, long-term care facility onset, or you have which long-term care onset events are further subclassified as an ACLO, or if you are able to see these dates in the screenshot, you will be able to determine this particular event was categorized as an ACLO. And that is because since the specimen date was collected more than 3 days after the current admission date, which is of January 8th, and since the resident was transferred from an acute care facility in the previous 4 weeks. There are analysis reports built into NHSN that will allow you to see a resident level record of all entered LabID events and the NHSN assigned categorization. Here is an example of what you expect to see. And as I mentioned previously, duplicate CDI LabID events will be excluded from rate calculations. I would also like to show another example of a resident with multiple CDI LabID events entered into the NHSN application, which will simplify the categorization explanation. So for example, incident is the first CDI LabID event that was ever submitted by the reporting long-term care facility. Duplicate is a CDI LabID event reported within 2 weeks, which is less than 15 days. Recurrent is an event which is greater than 14 days and less than 57 days, or incident LabID event, which is greater than 56 days after the most recent CDI LabID event. I will now discuss the monthly reporting plan to participate in the HAI surveillance reporting for LabID events. Remember, the MRP informs CDC which module or modules a facility is following during a given month. You should think of the MRP as the facility's commitment to entering data for a chosen event for the month. This plan will inform CDC which data can be used for aggregate data analysis, such as developing a national baseline. A facility must enter a plan for every month in which surveillance and data submission will occur. Plans can be modified retrospectively, and plans can be entered for up to 1 year in advance. So to enter a monthly reporting plan into the NHSN application, first you will need to select reporting plan and then add from the left navigation bar. You will need to select the month and year you plan to conduct surveillance and submit CDI data into NHSN. And for LabID event reporting for CDI and our MDROs, you will only complete the LabID event module section. And most importantly, make sure that you enter data for the red asterisk areas, and you can also click to add a row for additional LabID event modules you want to follow. And again, make sure you click Save. Now we will cover how to submit a CDI event into the NHSN application. Before we move forward with how to submit, I would like to share that the LabID event forms are available on the NHSN long-term care website. These forms are designed to collect the data that is required to be submitted into the NHSN application. If users decide to utilize the form, one form should be used for each LabID event identified. You may elect to print and use these forms. Both PDF and Word versions of these forms are available, and this also allows users to customize the forms to better meet the needs of the facility. I would also like to mention every NHSN form has an accompanying table of instructions that gives detailed instructions on how to complete the form. To enter a CDI or other LabID event from the home screen, users must click Event and then Add. As you can see, users also have the option to find events that have previously been entered into the NHSN application. For the purpose of this exercise, we will click Add to add a new event. And then next, you will need to enter the resident information, being sure to complete every field with a red asterisk. Next, the Add Event page will pre-populate with the facility ID. The user will need to enter the required resident information identified by the red asterisk. The first thing you will need to identify is if the resident is short stay or long stay. And a short stay resident is defined as being in the facility for 100 or less calendar days from the first date of admission. And a long stay is defined as a resident being in a facility for more than 100 calendar days from the date of first admission. Next, you will need to enter the date of first admission to the facility. Please note, if the resident leaves the facility and is away for 30 or more consecutive days, the date of first admission should be updated to reflect the date of return. So in order to enter the date of first admission, you will need to use the drop-down calendar. The date of current admission to the facility, you must remember that this cannot occur before the date of event. Next, we will scroll down to the event information section. For event type, you will need to select LabID event. The date of event will be the date the specimen was collected. And again, the event date and the date specimen collected cannot occur before the current admission date. Next, we will select the specific organism type that you are submitting for the event. And after selecting that specific organism type, the page will populate with all the relevant questions that coincide with your selection. Since LabID event was selected as the event type, the next box requires the user to enter the specific organism type. And as you will see, we selected C. diff. And since C. diff event is being reported, that is the organism type. And after selecting C. diff, the next two boxes will pre-populate with the specimen body site, system, And there are no other specimen source options when reporting C. difficile events into NHSN. So as you will see, the specific organism type is C. diff, the specimen body site is digest, and the specimen source we selected was stool. The next box requires the user to enter the location of the resident at the time of the specimen collection. And these locations were pre-populated, and they were added during the enrollment period of when the facility was set up in NHSN, and they should reflect all of the resident care locations within the facility. Most importantly, I want to point this out again. Resident care locations must be set up, which is known as mapped into the NHSN application before reporting events. If no location is mapped into the system, you will not be able to move forward with your reporting. Next, the user is required to select from the drop-down menu the single primary service that best represents the type of care the resident was received on the date the specimen was collected. There's a list of available service types that are auto-populated with NHSN service types, and this is not done by the facility. The drop-down options for resident care location and primary service type options will be the same regardless of the event being entered into NHSN. For the next question, which is, has the resident been transferred from an acute care facility in the past 4 weeks? If yes is selected, 2 additional required questions will populate for the user to answer. I would like for you to keep in mind, a resident visit to an ED or an outpatient, such as a physician office, is excluded since these outpatient visits do not represent an actual inpatient admission into an acute care facility. Also, NHSN application will be used to determine if this LabID event should be categorized as an acute care transfer, long-term care facility onset, or if it's a long-term care onset event. You will then need to answer if the resident was on any antibiotic therapy for this specific organism at the time of transfer. If yes, the resident should be included in the admission count for treatment on the monthly summary. As a surveillance measure, this will inform facilities of any CDI burden that is coming into their facility. If the resident is on antibiotic treatment for C. diff, you may see some of these common medications prescribed for treatment. The final question, which is used, documented previous evidence of infection or colonization with this specific organism type from a previously reported LabID event in any prior month, is a system auto-populated field and is based on prior month's LabID events. Yes or no will be auto-filled by the system only, depending on whether there is a prior LabID event entered for the same organism and the same patient in the prior months. This field cannot be edited by the user. And lastly, there are 2 fields which are optional. and they can be customized. And to customize, you can use up to 50 fields to be customized with date, numeric, or alphanumeric information. There's also a comment section and a place for users to add any additional information about a particular event. We would like for you, however, to keep in mind that NHSN does not use the data entered in custom fields or comments for any analysis functions. This screenshot provides a look at a completed CDI LabID event. Once the event is saved, it will be assigned an event number, and the user will receive a message at the top of the screen indicating the event has been created. Now we will review how to submit the CDI monthly summary data into the NHSN application. Here's an example of the monthly summary reporting form. Please note this form is optional, but is available for users to document any daily counts during the calendar month. The monthly summary data input for MDRO and CDI LabID event reporting seeks the following: resident admission, resident days, number of admissions on C. diff treatment, number of residents started on antibiotic treatment for C. diff, and also report no events if it's applicable. Resident admissions is defined as the total number of residents admitted to the long-term care facility during the selected calendar month. This will include new admissions and readmissions. I would like to point out a readmission is defined as a resident that was out of the facility for more than 2 calendar days and then returned. Resident days are calculated each day of the month at the same time each day, and it includes the number of residents which are within the facility. At the end of the month, you will sum the daily counts and only enter the total into NHSN. If you are participating in the CDI LabID event reporting, the facility will be required to enter the number of facility admissions who were on treatment for C. diff. This metric will allow you to analyze the overall CDI risk coming into your facility. You will also have CDI treatment starts, which includes the number of residents that are started on antibiotic treatment. I would like to point out, you must include all new CDI medication and treatment orders, regardless if the resident had a positive C. diff test result or met the CDI LabID event criteria. You will also notice on this slide a check mark in the box under the organism or organisms the facility has included in the monthly reporting plan and what they are monitoring for the month. In this case, this facility chose to only monitor CDI LabID events for the month. As a data quality check, the NHSN application requires users to verify in the application if no events were reported for that month. So for LabID events, the active boxes are dependent on which organism types the facility selected to report in the MRP. So for an example, you do have C. diff as being the only organism being reported. If there were no LabID events reported for that particular month, you must check Report No Events box. Here is a screenshot of a completed monthly summary data plan. Once saved, the user will receive a pop-up indicating the summary data was created successfully. As previously mentioned, fact-wide end surveillance and reporting is required for LabID event participation. This concludes the presentation. And if you have any questions, please ensure you send your question to nhsn@cdc.gov and add LabID reporting within the subject line to ensure your inquiry was routed to the appropriate subject matter expert.